If you've noticed itchy, red, purplish bumps on your skin, or strange white patches in your mouth, even changes in your nails or hair, you might just be dealing with a common skin condition known as lichen planus. Not a lot out there on lichen planus on YouTube. I do have a few other videos, but in today's video, we're going to do a deep dive on this skin condition. It's just not talked about as much as, say, eczema or psoriasis or acne, but it's a lot more common than you might think. In today's video, I'm going to walk you through what lichen planus is, what causes it, how to recognize it, and what treatments are available. If you or someone you know has been struggling with unexplained skin rashes, symptoms in the mucosa, this is the video for you. Make sure you give it a thumbs up and share it with somebody who might be struggling with this condition. What is lichen planus? Very strange sounding name for a skin problem. Welcome to dermatology. We love to give things not just one, not just two, but usually 3, 4, 5, or 6 or 7 odd sounding names. Lichen planus is a chronic inflammatory condition that can affect the skin, the mouth, the nails, and the hair. It's not an infection, and importantly, it's not contagious. So if you're dealing with this, don't worry. If someone touches it, they're not going to catch it. It's not a type of cancer, but it can be pretty uncomfortable. Not only is it confusing to cope with, but sometimes diagnosing it is not as straightforward or as easy. So it's even possible that you have this and you've been told it's something else. Most cases of lichen planus appear in adults around the age of 30 to 60. It tends to kind of come on suddenly, almost out of nowhere. Sometimes there isn't even an obvious trigger. Like you were perfectly fine one day and the next day you woke up and oh my gosh, what's going on? It can last for several months or even longer, and sometimes it goes through periods of remission only to recur again. Let's break down some of the different types of lichen planus. Lichen planus will look different depending on where on the body it shows up. On the skin, lichen planus typically appears as these red to purplish, flat-topped bumps. They're usually pretty itchy and they're often clustered together. The most common areas for lichen planus to show up on the body are around your waist, on your wrists, your forearms, your lower back, your ankles, and in some cases even your shins. And if you look really closely, sometimes you might even see this overlying fine white lacy scaliness. We refer to these as Wickham stria. After the bumps heal, they may leave behind a dark mark, especially if you're someone with a medium to deep skin tone. When lichen planus is in the mouth, we call that oral lichen planus. This is very common and often overlooked, especially if the doctor does not remember to look inside your mouth. It shows up as these white lacy patches inside the cheek, along the gums, or on the tongue. And sometimes there are even ulcers as well. It can be painless, but sometimes there's an associated burning sensation and even sensitivity, especially when consuming certain foods, especially when consuming spicy or acidic foods. Then lichen planus can appear on the genitalia. It can affect the vulva or the penis. It appears as these red areas, white patches, or painful erosions. To the untrained eye, it could easily be mistaken for a yeast infection or just some irritation. It can be very distressing to have genital lichen planus, especially if it's misdiagnosed, because treatments for irritation and for yeast are not going to make a difference for lichen planus. Then there's also scalp lichen planus. This is known as lichen planopilaris, meaning it's affecting the hair follicles. Also can affect hair follicles on other body sites like the eyebrows, for example, or the facial area. This form of lichen planus causes patchy hair loss. Initially starts out as these little scaly bumps over the hair follicles with some surrounding redness. There can be pain, discomfort, symptoms of sensitivity, a burning or tingling sensation. It often might affect the frontal hairline, for example, and could easily be mistaken for traction alopecia in some women or the receding hairline of androgenetic alopecia in men. But if the diagnosis is missed and it's left untreated, lichen planopilaris can actually go on to scar the hair follicle. And once a scar forms in the hair follicle, there's no turning back. You will never grow hair out of a scarred follicle again. That's why early identification and treatment is so important in order to preserve the hair. Lichen planus can also affect your nails. You might see ridges, nail thinning, and in severe cases, you can lose your nails. Sometimes it's just 1 or 2 nails, but without proper treatment, the nail changes can be permanent and they can leave behind limitations in mobility. Nails, as it turns out, are really important for our dexterity. So what is causing lichen planus? That's the $1 million question. The exact cause is not fully established, but it is widely believed to be autoimmune in nature, meaning your body's immune system attacks something in your skin or in your mucous membranes. And it can be triggered by certain medications, like certain blood pressure medications, non-steroidal anti-inflammatory drugs, or anti-malarials, such as hydroxychloroquine, chloroquine. It can even be triggered by a viral infection, infection, especially the virus that causes hepatitis C. In fact, in many cases with lichen planus, we'll even check for hepatitis C virus. Dental fillings or certain flavoring agents and oral care products are also a possible trigger of oral lichen planus. And of course, stress seems to trigger everything. And in this case, yeah, stress definitely can trigger or worsen a flare-up, though stress is not the underlying root cause. Importantly, lichen planus is not a hygiene issue. You did not get this because you're dirty or anything of that sort. It's not an infection. It's not something that you caught, and you're not going to pass it on to others, although there's likely an underlying genetic component, so it's possible that you pass on a tendency to develop the disease to your offspring. How is lichen planus diagnosed? Well, as with anything in dermatology, it starts by looking at the skin. A visual skin exam, checking inside the mouth, the genital area, looking very carefully at the nails and at the scalp. And if the condition is classic enough and how it's appearing, that alone could be enough, but honestly, in many cases, this is a tougher diagnosis to make, and some corroborating studies may be needed, such as a skin biopsy. Again, your doctor might choose to check hepatitis C virus as well, given its association with this condition. And of course, they'll be asking what medications you take, what dietary supplements you take, and they're going to be listening for any red flags of medications or supplements that can cause this to flare up. But because lichen planus can mimic so many other skin conditions like eczema, psoriasis, it's really important to see a board-certified dermatologist to get an accurate diagnosis. This is not something you can Google your way to the answer. It really needs proper evaluation. And like I said, in many cases, that involves a good skin biopsy, which is not something that ChatGPT can do for you. Here's the good news. Lichen planus, it can be treated, and most people will respond to the right therapy. So let's break down the different treatment options available. Treatment usually starts with, you guessed it, a topical steroid. And I know, that's what people think when they hear dermatologists. They think all they ever do is prescribe topical steroids. Topical steroids, though, they're such a huge category of different medications, and they're so powerful in dermatology because they help to silence cutaneous inflammation that drives these processes. So that's often a mainstay go-to treatment. Also, though, another class of topical medications that calms down inflammation in a very strategic way by addressing specific aspects of the immune system is known as a topical calcineurin inhibitor. These come with fewer potential side effects when applied topically over the long run in comparison to a topical corticosteroid, but they can be more expensive, and insurance is not always so keen on covering them. But these include tacrolimus and pimecrolimus, otherwise known as Protopic and Elidel. In the case of oral or genital lichen planus, calcineurin inhibitor may be something that is reached for more quickly than a topical steroid due to their gentler nature on these surfaces. Because calcineurin inhibitors can be so helpful for oral lichen planus, what your doctor might actually do is prescribe you tacrolimus in a pill form that is usually given that way to people, say, who have had an organ transplant to suppress their body's immune responses against their transplant. But rather than you swallow it, they'll have you reconstitute it in water and use it as a mouthwash. Swish it around in the mouth and spit it out. This can actually really help quite a lot. It's called a tacrolimus swish and spit. But in some cases of more widespread involvement, or once the scalp is involved, the hair follicles, the nails, oral treatments become more important and more necessary. Short-term courses of oral steroids like prednisone may be indicated. Immunosuppressant medications like methotrexate or cyclosporin can be game changers. In some situations, phototherapy can also be very helpful to silence the inflammation. And there are a ton of newer biologic medications that can be prescribed that address very specific aspects of the immune system to silence down that inflammation. But there are a variety of supportive care approaches that are necessary as well. For oral lichen planus specifically, you want to avoid spicy or acidic foods. I say avoid chewing gum. Like that intense flavor coating on Doritos, it's delicious, but it does not do the lichen planus any favors and can be very uncomfortable. Also, watch out for the spicy mint or cinnamon flavors of your toothpaste. Instead, you may choose to use a kid's toothpaste with a fruitier flavor like strawberry. It tends to be a lot gentler on the oral mucosa. For genital involvement, whatever you do, do not pursue any kind of vaginal washes in the case of women, or like douches. These can end up actually being pretty irritating to this condition, especially if they have added fragrances. Consistently moisturizing can help alleviate some of the itch, but it won't take it away. Here's something though that is really important. Like if you take anything away from this video, I want you to remember this. This is not just a cosmetic skin issue. Lichen planus can be very painful, it can be disfiguring, and in the case of genital lichen planus, there is a small increased risk of squamous cell carcinoma of the genitalia with chronic lichen planus that goes untreated. So it's important to have ongoing monitoring with your healthcare provider. All right, so to recap, lichen planus is a chronic inflammatory condition that can affect the skin, the hair, the nails, the mouth, and the genitalia. It's often itchy, uncomfortable, and it can be, in many cases, difficult to diagnose. But with the right treatment, most people get pretty remarkable positive results and see significant improvement. The key, as with most things, is to get it diagnosed early so you can get started on the most appropriate targeted treatment. Remember, you're not alone. This is a condition that we see all of the time in dermatology on a daily basis. All right, y'all. So I really hope this video was helpful in clarifying what lichen planus is, what it looks like, how it can appear, where it can appear, and the treatment options available. Let me know in the comments, is this something you have heard of? Do you have this diagnosis, or do you know someone who has just received this diagnosis? If so, I hope this video was helpful. If you feel comfortable, share that in the comments, because a lot of people who are also struggling with this will see that and it will help them know that they are not alone. If you guys enjoyed this video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye!